Trump administration has launched a series of advertisements aimed at fighting opioid use in young adults. It partnered with the Truth Initiative, who released 4 startling commercials Thursday. The ads feature real stories of young American adults and how quickly their opioid addiction spiraled. The CEO of the Truth Initiative characterized the campaign by saying, quote, "We're not sugarcoating anything." We want to play you one of those ads, but first, a warning that much of what you're about to see is graphic and disturbing.
I tried Oxy at a couple of parties. I thought I had it under control. I didn't know it'd be this addictive. I didn't know how far I'd go to get more.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
Joining me now is Dr. Harshal Kirane. He is Director of Addiction Services at Staten Island University Hospital. Dr. Kirane, the president first announced the campaign would include such advertisements at an event in March. I want to take a listen to what the president said then and then talk about it.
This has been something that I've been very strongly in favor of. Spending a lot of money on great commercials showing how bad it is, so that kids seeing those commercials during the right shows on television or wherever, the internet, when they see these commercials, say, I don't want any part of it. That's the least expensive thing we can do, where you scare them from ending up like the people in the commercials.
The president certainly believes in marketing, but does it work? Does scaring young adults about the issues around opioids lead to less abuse?
So I think from the outset, defining how things are efficacious in addiction treatment can be challenging. At one level, you want to determine whether folks are actually initiating use, and separately, whether folks who are already struggling with use are actually accessing care. For the most part, most studies that have evaluated scare tactics largely come from Europe and are still somewhat dated, looking back to work from the 70s and 80s. And for the most part, most of these post hoc studies evaluating the impact of scare tactics have shown that they're not useful. And that's for a number of reasons. And particularly when we're looking at targeting scare tactics towards young adults, for one, the fundamental aspect of any kind of clinical intervention with young adults is to try to engage them, to try to open an honest dialogue, to try to actually make them interested in accessing care. At its heart, scare tactics really undermine that.
There's a concern in some quarters that these ads could actually demonstrate to people how you might get a refill on your pills. Could these ads trigger copycats?
I think there's always potential for that. I think in some ways the ads harbor a really tragic irony that individuals are depicted going to such great extremes to access opioids, when if we were expanding access to addiction treatment, then they'd be able to simply walk in and access the type of care and support that could be helpful for them. I think in the presentation of any kind of sensational content, it runs the risk of some copycats. I think a much bigger danger is that it represents this really grotesque depiction of an illness.
That illness being addiction.
Correct. And a parallel would be in the context of this week's national tragedies with Kate Spade or Anthony Bourdain, if we were running some kind of anti-suicide campaign where you were depicting some grotesque acts of suicide and saying, hey, don't do this. That seems pretty preposterous. So here, while there are certainly extreme circumstances that can unfold in the course of an addiction, the hope would be that folks are actually accessing care farther upstream before it comes to such times.
The majority of heroin users today have been shown to have begun their opioid journey on a prescription opioid. Clearly, some of those individuals were abusing by choice, but many were using as directed and felt caught, captured. As a doctor prescribing these sorts of drugs, what do you recommend for making sure that the fewest number of people using as directed stay on the path that you want them to?
So I think in the ongoing kind of analysis of the source of the American opioid crisis, there are a lot of culprits that have been identified, from big pharma to government policies to physicians and a number of different healthcare entities. Moving forward at this point, the responsibility that comes around managing an opioid prescription really falls on a number of folks. First and foremost, healthcare providers to actually be informed about strategies that involve opioids.
20 years ago, 20 years ago, there was an idea of opioid phobia. Doctors being concerned about addiction and not prescribing it so much. Purdue Pharma had to overcome that to get OxyContin into the American mainstream. Do you think we need more opioid phobia at the medical level?
I think that's perhaps in line with what's being presented in these ads. And as the past has taught us, that's not effective. I think we need more.
Not for potential users, but also not for doctors.
But not for doctors as well, absolutely. And what we need is accurate information. And there is, in fact, a number of new guidelines that have been percolating over the last several years from the CDC, National Institutes of Science, and that are now starting to actually translate to the bedside. And for an outline of that, it really starts first and foremost by actually screening individuals. If it's in the context of providing an opioid prescription, there are a number of tools. The most common is called the ORT, the opioid risk tool, which is intended to help not only the clinician, but also the individual who's potentially getting opioids to recognize factors that may in fact put them at risk for subsequently developing opioid dependence.
If somebody watching this is dependent themselves and looking for help or knows somebody who is, what should they do?
So I think the first outlet would be to start the conversation with their primary care provider. If that is not something that they have, or that conversation's not happening for whatever reason, and unfortunately that's the case for many folks, that addressing issues related to addiction or the management of opioids just doesn't take place with their primary care providers. The major outlets that we generally refer to are SAMHSA, which is one of the national organizations that's geared around substance abuse treatment and policy. There are a number of resources, treatment locators that can help direct folks all throughout the country to addiction specialists or similar resources in their community.
Dr. Harshal Kirane, I wish we had solved it tonight, but we didn't. Thank you very much for being here, though.
I appreciate your time. Thank you.